Hello and welcome to another telehealth information video. My name is Garvin and today's video is on Symmetrel. Symmetrel contains the active ingredient Amantadine hydrochloride, which is a type of medicine used mainly in the treatment of Parkinson's disease. Symmetrel is used to treat Parkinson's disease as well as pain associated with shingles. Dopamine and acetylcholine are neurotransmitters, meaning that they are involved in transmitting nerve messages to and from the brain and the body and around the body. Both dopamine and acetylcholine are very involved in motor control or physical movement. Normally there's a balance between the activity of dopamine and the activity of acetylcholine in the brain. However, in Parkinson's disease, the deficiency of dopamine causes overactivity of acetylcholine. This causes some of the symptoms of the disease. Amantadine works by blocking the receptors that acetylcholine acts on. This reduces the activity of acetylcholine and helps restore the balance of acetylcholine and dopamine in the brain. Amantadine also increases the amount of dopamine in the brain. Amantadine also affects a third neurotransmitter called glutamate. Glutamate is a neurotransmitter that acts as a natural nerve exciting agent. Overactivity of this neurotransmitter is also thought to play a role in causing the symptoms of Parkinson's disease. Amantadine blocks the receptors in the brain that glutamate usually acts on. In these ways, amantadine helps control some of the symptoms of Parkinson's disease. The dose of Symmetrel may vary depending on the condition and severity of condition being treated. Make sure to take Symmetrel exactly as your doctor has prescribed to you. If you're unsure of your dose, be sure to ask your doctor. For Parkinson's disease, you usually take the medicine once a day to begin with and increase this to twice a day after 1 week. If necessary, your doctor may increase your dose at weekly intervals until your symptoms are under control. For shingles, this medicine is usually taken twice a day for 14 days. It can be continued for another 14 days if you are still having pain. Symmetrel capsules can be taken either with or without food. Symmetrel should not be used during pregnancy or when breastfeeding unless considered essential by a doctor, and only if the benefits to the mother outweigh any risks to the baby. So get medical advice from your GP if this relates to you. You should avoid driving or operating heavy machinery while using Symmetrel, as its effects may likely impair your ability to carry out these tasks. Make sure to tell your doctor what other medicines you're taking, as they may have undesired interactions with Symmetrel, especially psychiatric medicines such as benzodiazepines and antidepressants. Some side effects of Symmetrel may include dry mouth, muscle pain and headache. For a complete list of the side effects, go to my website www.lynchespharmacy.com. And remember, all medicines have potential side effects, but this doesn't mean that you'll experience them. That brings this video to an end. If you have any questions, make sure to leave them in the comments below or contact me through lynchespharmacy.com. Thank you for watching. Stay healthy and stay informed.